The physician's order shows that the patient will be receiving Lasix 30 milligrams IV now. The patient has a central line and the medication will be going through that. Before I go to the patient, I will grab the medication, which is shown as 40 milligrams per 4 milliliters. I'll grab my alcohol swab, 2 saline flushes, and a 3 milliliter syringe. The physician has written an order for 30 milligrams of Lasix IV. The available medication is in 40 milligrams per 4 milliliters, so we'll have to do some math. So we'll be looking for the amount of milliliters we'll be giving to the patient. The medication comes in 4 milliliters per 40 milligrams, and the dose is 30 milligrams. The calculations, that comes to 3 milliliters. Knowing that I need 3 milliliters of the Lasix, I will choose a 3 milliliter syringe over the 6 milliliter or 10 milliliter syringe. Hi, my name is Carrie Ann, and I will be your student nurse today. Can you please tell me your name and date of birth? Okay, I'm just going to check that with your wristband. Alright, perfect. Can you tell me if you have any allergies? Oh, you don't have any drug allergies. Great. So today you're going to be receiving 30 milligrams IV Lasix or furosemide. It's for the edema that's in your legs. You might get some lightheadedness or tinnitus with this medication, which is ringing in your ears. So if you experience either of those, please let me know, and also push your call light if you need to get up out of the bed. Any questions? Okay. Before we begin, I'm just going to assess your central line site for any signs of infiltration. Signs of that would include inflammation, blanching or coolness of the skin surrounding, and a wet dressing, which does not appear to be any of those. So we're good. I've now washed my hands, and I'll proceed by putting my gloves on and scrubbing the hub of the port for 15 seconds. With the alcohol prep pad that I grabbed earlier. I'll be using the distal lumen in order to give this medication. That was 15 seconds. I will now administer 10 milliliters of sodium chloride or normal saline flush. Lasix or furosemide should be given 20 milligrams per minute. Therefore, I'll be giving 30 milligrams over 1 minute and a half. It's been 1 minute and a half. Now that I've pushed the 30 milligrams of IV Lasix, I will now conclude with another 10 milliliters of sodium chloride to flush. After I've flushed, I will reclamp the site. I'll dispose of my syringes in the proper site. I will then ensure that my patient's bed is in lowest position and that her call light is within reach. So the call light's over here, and I will lower the bed. I'll then remove my gloves and wash my hands at the sink. I'll then return to my desk and document that the patient received 30 milligrams IV Lasix through the distal lumen of their central line. There were no complications and the patient reported no side effects or other symptoms.